first I want to say thank you to all Montrealers for their contribution in preventing this third wave and supporting us in our suppressive approach during the last few months. I think it paid, and we have avoided a third wave collectively. We wouldn't be talking about reopening different sectors of activity right now if we had been in a third wave in April or beginning of May, so I think we can rejoice ourselves. We were vigilant, and I think it paid, and still, while we are reopening certain activities, we still have to be vigilant in the way we reopen the different sectors. If we look at the epidemiological situation in the last week, we had 1,483 new cases. It leaves us in the red zone, but really we are flirting with the orange zone. We've seen in the last couple of days that we have really low numbers, but they are associated with a low level of screening in the population, probably linked with the weekend, the festivity of the weekend. So we'll see if the tendency is pursuing in the next couple of days. The change that we are seeing is in the incidence rate. We mainly had high incidence rate in school-age children, but right now we are seeing an increase in the 18-24 years old group. So we really, and in this group, we also have higher positivity rates. So we really encourage them, the youth, to get tested if they have symptoms, if they, of course, have been in contact with a case, to, of course, respect the measures, the public health measures. Even if you have one dose of vaccine, you are not fully immune. So it is important to maintain those measure in place. And of course, if you haven't had your vaccination, your appointment for your vaccination, I think it is time to get it soon. We are still managing more than 216 outbreaks. We are seeing a decreasing in the number of outbreaks in workplace, 84, schools 64 outbreaks, daycare center 26, and only 12 in healthcare settings. What we are seeing is a small increase in the number of outbreaks in the community, and this is what we are expecting in the next couple of weeks, because we are reopening those sectors. And we have 9 of those 16 outbreaks where we have an association with parks. So even though we know that the risk is lower outside, do not share glasses or other food or material that can contribute to transmission of COVID. The vaccination campaign is progressing. Our goal is to attain the 75% coverage for the 12 years old and older. At the time we're speaking, we have more than 50% of this group that have been vaccinated. And when we look at the appointments that have been taken for the next 2 weeks, we are reaching 69%. So we're getting close to our objective. So we have a different strategy. In the next couple of weeks, we will do the vaccination of the groups, the school age group 12 to 17 years old. We are continuing the second dose vaccination in HLM and elder residency, and we will add, as we get more vaccine, more sans rendezvous. I forgot the sans rendezvous. So we can, because we have seen that youth people are responding well to this form of access. So what I want to say to finish is that even though we are progressing in the right direction and we can be proud of what we have done for the third wave in Montreal, we still have to be vigilant. Get your appointment, get tested. Don't forget the reflex of getting tested, and continue to collaborate with public health, because the more we open, the more we have contacts, the more we have to be aggressive in finding those chain of transmission and cutting them down easily. Thank you.